Hello, everyone. Thank you for joining us on another episode of BAEP Talks With, a 30-minute discussion with a person of interest who has experience with living with, managing, treating, and/or supporting others with a chronic menstrual health disorder. My name is Shante, I'm the Vice President of the Barbados Association of Endometriosis and P.C.O.S, and I'm also your new host for BAEP Talks With. Today, I am joined by Dr. Cortney Yarbrough, a board-certified obstetrician and gynecologist. She completed her medical training at Tulane University School of Medicine in New Orleans, Louisiana. She then completed her internship and residency training at Baylor College of Medicine in Houston, Texas. She went on to complete a fellowship in Pediatric and Adolescent Gynecology at the Hospital for Sick Children in Toronto, Ontario, Canada. She's currently practicing as a general obstetrician and gynecologist here in Barbados at JRB Medical Centre at number 12, 10th Avenue in Belleville. At this location, she specializes in the care and evaluation of the specific gynecological needs of young girls, adolescents, young women, and adult women of all ages. She counsels adolescents, young women, and adult women on STI prevention, safe sex, and the HPV vaccine. She evaluates and manages early pregnancies and their complications and gynecological conditions that occur across the age spectrum, including abnormal menses, dysmenorrhea, endometriosis, fibroids, menopausal symptoms as well. She has a monthly online webinar entitled Adolescent Health and GYN Discussion Group, where Dr. Yarbrough discusses a different topic each month. And these sessions focus on the medical and gynecological conditions that affect adolescents and young women, such as puberty, abnormal versus normal menses, safe sex, and STI prevention, along with the HPV vaccine. Dr. Yarbrough is dedicated to teaching and guiding women about their gynecological needs, starting at an early age with the goal of empowering them to make healthy lifestyle choices for their present and their future. Welcome, Dr. Yarbrough.
Thank you. Thank you very much.
I'm so glad that you are here today with us. So thank you for taking the time out to be here for us. Okay, so when I first heard about this pediatric and adolescent gynecologist, this will be my question to you. What is a pediatric and adolescent gynecologist?
So pretty much we train like every other obstetrician gynecologist, so I am a board certified gynecologist, but I do focus on the health care of our young women, our youngest women.
I'm glad that we have that understanding now, because I'm sure like many other persons within our communities, we never heard about this. So I'm truly glad that you're here. Okay, so my next question to you would be, what led you to this field? What made you say, okay, this is the route I'm going to go?
Interestingly enough, it probably really started when I was junior high school, even high school. Mm-hmm. I had my sister, she had really, really bad periods. I mean, she would miss school. It was so bad. And then my best friend, who I've been best friends with for over 30 years, mm-hmm. emergency surgery for an ovarian cyst. And they removed her entire ovary, which I thought that was maybe a bit much at the time. That got me interested in teaching young women and women how to take care of themselves. Because really the things that we deal with as women start in our teen years for the most part.
I'm truly glad that you experienced things from others, and that made you say, hey, let me go into this field to see if I could help others. Okay, so I heard you talk about, babies may have issues gynecologically. My question to you would be, why would I bring my baby to see you? What concern may I have that would say, okay, let me take my child to an adolescent or pediatric gynecologist?
Okay. So it really depends on the age of the child. Some of the most common things I see in children who are younger, who have yet to start their puberty, so they haven't started any puberty, they haven't started their periods, are infection type issues. So you might have a child who has a infection on the lips of the vagina, And when that infection heals, the lips of the vagina can actually heal together and stick together. That's called labial adhesions or labial agglutination. And sometimes just looking at that and look at the anatomy of the child can really freak parents out. So that's one of the most common things I see in that age group. And then also in the age group, the urethra or the tube that comes from the bladder through to the outside that we pass water through, that can actually kind of prolapse or kind of fall out a little bit, not all the way out, but fall down a little bit and cause a little redness and bleeding. And that is something common too that I see, especially in women and children of African descent. So that's a common condition in children who are younger before puberty. Now, once puberty starts, you can have the issues of early puberty. You can have issues that once the puberty starts, even if it's normal, you can have irregular periods, painful periods, or very long periods. So those are the most common conditions that I see in my young teens as well as my older teens. And then in my older teens too, I tend to discuss with them things like safe sex and contraception and protecting themselves against sexually transmitted infections. So depending on the age and what your condition is and your concern is, those are the most common reasons that I see young girls as well as young teens in my practice.
Okay, great. If I'm bringing my child to you for the first time, what should we expect on our first visit?
So the first thing I always tell most young girls, I say, well, don't worry about it. I know you're nervous. There's not going to be an exam. We're just going to talk. And that usually makes them a lot more comfortable because when they hear about gynecologists and, even moms, like you said, most people don't even know that a pediatric and adolescent gynecologist exists. So the first thing they think of is that we're going to do a pelvic exam on these young girls. And 9 times out of 10, I do not have to do a pelvic exam on a young girl. Most of the conversation is just conversation. And then if I need to do an exam, most times it's all external. So nothing that's going to be harmful or painful to the child. So most times the initial consultation would be a discussion. I may send them to the labs for lab work. I may do a quick external exam just to see how they're developing. A lot of times when I'm talking about puberty or irregular periods, I need to rule out a few other conditions that can cause abnormal periods. So I might do an external exam to look at how they're developing as well. So usually the first visit is really a discussion and maybe a small exam, and I may send you to the lab at that point for blood work.
Okay, I heard you talk about the most common things you would see with young patients. How prevalent would you say menstrual health issues are among adolescents?
Oh, menstrual health issues are very common in our adolescents. So, the average age of your period first starting is age 11 and 12. But in our young women, we can also see periods starting as early as age 9, and that would still be considered normal. But in the first 3 to 5 years after your period first starts, most young girls, their periods are slightly irregular. So they may skip a month here, skip a month there, and that's very common. But when we say if you're skipping like more than 3 months at a time, or if your period is coming and it's lasting really long, like lasting more than 10 days, or it's really extremely heavy or painful, at those times you need to not just assume it's normal, you need to come in for evaluation to make sure everything's okay.
Okay. With that question also, would you say that there's a relation between the age you get your menstrual cycle at and having the possibility of you having a menstrual health disorder?
No, not necessarily.
Not necessarily.
Not necessarily. Some young girls will start their periods as early as 9 and 10 and have a regular period from day 1 and never have any issues at all. Others will start their periods a little later and they may have pain right away, or they may have heavy bleeding right away, or they may skip their periods, in the very beginning. So just because you start earlier doesn't mean you'll have irregular issues or issues with your periods at all.
Okay. Okay, so a parent, would you say that they should take their child to a pediatric gynecologist just as they would go to see their normal pediatrician?
So I do think, especially in this day and age, that it is important that the parent take their child to see a gynecologist when they first start their periods, just so they can have a discussion on what's normal. And maybe have a discussion on how often they should change their pads or their tampons and cleanliness and things like that. And then also have a discussion on what to look for that's not normal. Just a discussion to introduce them to their new gynecological health. And at that point, if everything is normal and there's no issues, they don't have to come back for 1, 2, 3 years, whatever they feel comfortable doing. I do recommend that around the ages of 14, 15, 16, they should have a conversation with their daughters about sexual health, because we all know that young sexual activity really does start in our later teen years for most young women. So if they have an open and honest conversation about that in their home, that's fine. But a lot of parents don't feel comfortable with that conversation. So they are more than welcome to come in, and I can also have that conversation also with their daughters if they like as well.
So you're basically like the mediator in between the two.
Exactly.
Yes, and I that is a good thing, because I find within the Caribbean context, we don't like to speak about menstrual health, and I think having you there would be beneficial to a lot of young women. So let's say I'm a parent of an 8-year-old child, and my daughter has period for the first time, but yet again, I was brought up not to talk about these things, not to, just take it and, not talk about it. And if I'm in pain, just take a Panadol or whatever. What advice would you give to a mother dealing with a young child with their first menstrual cycle?
Well, first of all, the first period of the age of 8 is a little young. So I would definitely bring her in for evaluation first, number one. But let's say your daughter's 9, 10, 11, and it's her first period, and you want to have that conversation with her. I definitely would teach her, first of all, how to monitor her periods. So, at that age, they may not have a cell phone yet. So you can give them a calendar so they can write down, when their period's coming. You can, and also on that calendar, I would recommend that they write down any associated symptoms. So do they have any spotting associated with it before their period starts? Do they have any pain associated with it? Do they have other symptoms like nausea or feeling sick to their stomach or feeling very tired or fatigued? Or are they in a lot of pain? So that's those are the questions that if they have issues, the doctor will be asking anyway. So if you teach them how to notice and monitor their periods and any symptoms that may go along with their periods, that's a good thing to start off with. And then they'll get used to knowing what's normal for them, because the number of days between a period can be different for every woman, right? So it's not always the same. So if they know what's normal, then they can always tell you, well, it normally happens this way, but now it's doing this. So is there something I should be concerned about? So it's empowering them to pay attention to their health, right?
Yeah.
Because their menstrual health can also be tied to their other health too. If diabetes or high blood pressure, any kind of other physical health issues can affect your period. Because our bodies are very, very, very smart. Our bodies, if it gets really sick or really tired or really fatigued, will stop something that it does not need to do. And one of the first things that it does not need to do to survive is your period. That is not necessary to live. You need to breathe, your heart needs to pump, your brain needs to work, but you do not have to have a period. So if your periods were normal, and then all of a sudden it stopped or they're becoming irregular, that can be the first sign that something else is going on.
Okay. Yes. So in talking about that, I know within the Caribbean context, again, we don't do a lot of things. So normally overseas, you would hear a person saying, "Oh, I have to go for my yearly checkup." Would you say that a visit to the gynecologist should be the same as should you include it in your yearly checkup?
For a young woman, young girl, not necessarily. Go ahead.
Not for a young woman.
Not for a young girl. A teenager, yes, for sure. A teenager, I would say, anyone 15 and older, I would say they should have an annual exam or an annual discussion. It could just be a discussion, not an exam per se. Just to, talk to them, see where they are, how they are physically, how they are mentally, how their peers are going. Our young people are dealing with so much these days. They may need that extra attention, for lack of a better word, to have that discussion. So as a young girl, unless they're having an issue, now if they're having an issue that I like to monitor, I'll let the parents know. But if just for an annual checkup, then we can just wait till about 15, 16 years old to start those. And again, those do not always necessitate an exam.
Okay. And would you say that anytime in your practice you would have seen boys? I know you deal with women, but
yeah. So most times I do not see boys. I am a gynecologist, so a gynecologist by trade. The only time I have done the online talk talking about puberty for boys, so I've had a complete boy panel then. And then for those parents who want the HPV vaccine for boys, I will offer that to them as well.
Okay.
Yeah, but I don't treat them.
Okay. So one more question for you, Dr. Yarbrough.
Yes.
Let's say a teenage girl finds out that she has endometriosis. Would you say that there needs to be a routine, I want to say routine checkup that would include ultrasounds and maybe blood tests and stuff like that? Would you say that that is something that needs to happen?
So the thing about endometriosis, and you know this, I'm sure, is the only way you can definitively diagnose it is with surgery. Okay. So if a young lady comes in her teens and she's in severe pain, severe enough she's missing school or missing her activities, I'm going to assume endometriosis at that point, even though I can't prove it yet, and treat her accordingly. Yes, and with pain too, when a person comes in with pain, one of the first things we always do is an ultrasound, because we have to make sure there's no other reason for the pain. Right. So because endometriosis, you cannot always see an ultrasound. So if you have an ultrasound that's completely normal, meaning all your genital organs are normal and your pain is not associated with your bowel habits like diarrhea or constipation and things like that, then I will assume that you might have endometriosis, especially if you have a strong family history of it. If you have a family history, there's a mother or a sister or an aunt who has endometriosis, it's very likely you have endometriosis. So with those patients, I do see them regularly because we have to get it under control and manage it sooner than later. They do not usually require surgery right away. I only will do surgery in those patients who all their other management options, the hormonal management, the pain management, is not working well for them. And I do that because endometriosis is a lifelong condition. So we don't want to do surgery after surgery after surgery. We want to be able to manage it medically if we can. And that way too, hopefully we will prevent it from progressing further to cause issues, later in life, like infertility or adhesions or chronic pain. So yes, as an adolescent, and I strongly feel, so I can't diagnose you technically, but I strongly feel you may have endometriosis. We're going to see you on a regular basis. And then once we have it under control, I might not see you 3 or 4 times a year. I might just see you twice a year, just to make sure that the medication that we're giving you is still managing your pain.
Okay. As you're talking, questions are coming all the time. You said the history, family history. Yes. Would you say that with other menstrual health disorders, because for me, I was diagnosed with endometriosis and I didn't know that my mom had P.C.O.S. It's only when I had my diagnosis, I found that out. So would you say that the other conditions too, if I'm a mother and I have endo, my child may come with some menstrual?
Yes. Yeah. So it doesn't matter. Yeah, it can definitely run in families. P.C.O.S, endometriosis, even the frequency of having ovarian cysts can run in families. Now, the thing is, you have to keep in mind that, not just your mom's side of the family, you have your dad's side of the family too. So you might take after your dad's side, and if they didn't have any issues, you may not have any issues, but you might take after your mom as well. So, if your mom had endometriosis or infertility or any other issues that can be gynecological can run in families for sure. Yeah.
Okay, glad to know.
Yeah.
So I want to ask one more question. With what I want your take on this. Here in Barbados, we don't talk about menstrual health, as I said. In the Caribbean, we don't really talk about it. How important would you say is for women, men, everybody to educate themselves about these conditions?
It's very important. I feel like that's why God put me on this earth, to help people know what these conditions are, because they start so young, and women have to deal with it and suffer with it for such a large part of their lives. So I feel like you can only do better if you have the information, right? You can only treat it sooner if you have the information. So why not talk about it? I know it's hard. It's hard. It's even in the U.S. I'm from the U.S., as you can see. Even in the U.S., the African family, we don't talk about our medical issues. I mean, I think my generation was the first generation that really started talking about the medical issues. So, I may not even know if my grandmother had endometriosis. I don't know if my grandmother had endometriosis or whatever, because they just didn't discuss it back then, or they didn't go to a doctor, because they have issues with trust as well. So it's so important. And it's definitely important to include the men in our lives, because I know men, and I think some women as well, they just think, oh, it's normal to have pain with your periods. It's normal to have bad periods sometimes. That is not normal. I don't care what anyone says. It is not normal. And we have too many medicines and management ways to manage those things so that you don't have to suffer every month. I mean, who can be productive and you're in pain? I mean, or you're worried about overflowing or soiling your clothes when you're in a meeting. Who can be productive? So it's just better to know what we're dealing with, know what you're dealing with, so we can help you with it. And educating your family about it too.
Yes. At BAEP, we always emphasize the importance of educating yourself, and also understanding that these conditions are not just bad periods. It's okay to have some pain, some discomfort,
right?
But if you are to the point that you cannot be productive, as you said, you can't go to work, you can't go to school, you can't get out of bed, you can't sit up straight.
That is not normal.
It's not normal, and it's not just a bad period, as some persons would say.
Correct.
Yeah. So thank you, Dr. Yarbrough, for coming on tonight.
Thank you.
I had a very good discussion with you, and I hope that you had a good time as well.
I did.
I hope to keep in contact with you.
Of course.
Yes. Okay. So have a good night.